Good day, everyone. We're coming on the air for an important briefing from the White House's COVID-19 response team. The CDC expects to announce a major change in COVID guidelines that will allow fully vaccinated people to stop wearing masks indoors in most instances. It comes as more Americans are vaccinated and the rate of infection is slowing. We want to join now that briefing in progress.
It's beginning to take hold. Case counts, hospitalizations, deaths, virtually every metric is now improving consistently and in most of the country. Today, COVID-19 deaths are at the lowest point since April of 2020. Dr. Fauci has reviewed study after study on these calls, demonstrating the real-world impact of vaccines in driving these results. Recent progress has been especially strong. Since everyone 16 and over became eligible for vaccination, cases have dropped by 45%. And since everyone became eligible 3 weeks ago, that is everyone 16 and over, a full 12% of adults have become newly vaccinated. In a wartime effort, we must begin to press harder when we have an advantage and not let up. Yesterday, individuals 12 through 15 years old became eligible for the Pfizer vaccine. We are putting every resource possible to bear and leveraging every possible partnership in the country to reach people who aren't vaccinated yet and to make it as easy as possible for them to get a shot. More than 20,000 local pharmacies in communities across the nation are now offering walk-in vaccinations. You can text your zip code to 438-829 to get 3 locations near you with vaccines in stock. Soon, you'll even be able to book a free ride through that text from Uber and Lyft. As the president announced, Lyft and Uber are offering free rides to anyone who wants to get vaccinated between May 24th and July 4th. If you want to sort by the specific vaccines, millions of McDonald's cups tell you where to go to, vaccines.gov. Efforts around the country are not letting up, and they cannot let up. They must accelerate with everyone contributing what they have to the effort. Let me close and hand it off to Dr. Walensky by reiterating some of the words the president said yesterday. On July 4th, let's celebrate our independence as a nation and our independence of the virus. 70% of adults with at least one shot by July 4th is a critical goal. When you're winning, you press harder. We can do this. But if you haven't gotten vaccinated yet, now is the time. And with that, over to Dr. Walensky for an important update and what our progress means for Americans.
Thank you, Andy. Good afternoon. I'm pleased to be back with you today. Let's begin with an overview of the data. Yesterday, CDC reported more than 34,200 new cases of COVID-19. Our 7-day average is about 36,800 cases per day. This represents yet another decrease of about 23% from our prior 7-day average. And every day, with daily cases continuing to fall, we remain encouraged by these positive trends. The 7-day average of hospital admissions is 4,100. Again, another terrific sign with another back-to-back decrease of 12% from the previous 7-day period. And 7-day average daily deaths have also declined to 587 per day. Today, I have several exciting announcements to share with you. First, since becoming CDC director, I have seen firsthand the current frail state of the public health infrastructure in this country. I'm committed to upgrading the public health system so the nation is ready for whatever comes next. With this in mind, today we are announcing the upcoming release of $7.4 billion in funding from the American Rescue Plan to hire, train, and support public health workers across the country, reflective of the diversity within the communities they serve. Over half of the money being released, $4.4 billion, will support states and localities, creating tens of thousands of new jobs in communities across America, expanding our overstretched public health departments with new hires to support their COVID-19 efforts. And $3 billion will be focused on preparing these same jurisdictions for future pandemics and to build a public health workforce for the future. Though many threats have increased in complexity and scale in recent years, our nation's public health workforce has gotten smaller. This support will immediately add more staff in health departments across the country. It will add school nurses to K through 12 schools to support safe reopening and operations and support vaccinations as vaccines are authorized for younger people. It will expand the number of CDC Epidemic Intelligence Service officers, our elite disease detectives, to respond to local outbreaks and help curb the pandemic. It will expand public health career paths, recruit and train a diverse group of future public health leaders, and launch a public health AmeriCorps to recruit a strong, diverse, and highly skilled workforce that is ready to respond. And it will create new programs intended to increase staffing at our nation's laboratories and build preparedness for the future. We are really excited about what this support will mean for our nation's public health capability now and into the future. Second, last night I endorsed the recommendations of CDC's Advisory Committee on Immunization Practices, making the Pfizer vaccine available to anyone who is 12 years and older. I want to thank the ACIP for reviewing the science and providing their recommendations on the safety and efficacy of the vaccines in adolescents. This is an important step forward in our efforts to vaccinate as many people as possible and to stop the pandemic. And finally, I want to provide you an update regarding CDC's guidance for fully vaccinated people. Over the course of the pandemic, we are continuously gathering data and evidence to inform our guidance and decision-making. We now have numerous reports in the literature that demonstrate the safety and real-world effectiveness of the authorized vaccines. On this slide, there are 3 recently published studies, one from Israel published in the Journal of the American Medical Association, or JAMA, on the top, and 2 from the United States, both published in CDC's Morbidity and Mortality Weekly Report, which all show that COVID-19 vaccines work. In Israel, there was a demonstrated 97% vaccine effectiveness against symptomatic and 86% effectiveness against asymptomatic infection in over 5,000 healthcare workers. In the United States, vaccines were 90% effective against any infection in nearly 4,000 healthcare workers and 94% effective against hospitalizations from COVID-19 in an evaluation across 24 hospitals in 14 states. Additionally, we are accumulating data that our authorized vaccines are effective against the variants that are circulating in this country. On this slide, you can see a study published just last week that demonstrates how effective the Pfizer vaccine is against the common circulating variants in the United States, B.1.1.7, as well as other variants like B.1.351. Additional studies confirm that the Moderna and Johnson & Johnson vaccines are also effective against circulating variants. Finally, we know that in the rare event that people get infected after a vaccine, the resulting infection is more likely to have a lower viral load, be shorter in duration, and likely less risky of transmission to others. Considering all of these factors, the data on vaccine effectiveness, the science on their ability to protect against circulating variants, and our growing understanding of the low risk of transmission to others, combined with universal access to vaccines for those 12 and older, today, CDC is updating our guidance for fully vaccinated people. Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing. If you are fully vaccinated, you can start doing the things that you had stopped doing because of the pandemic. We have all longed for this moment when we can get back to some sense of normalcy. Based on the continuing downward trajectory of cases, the scientific data on the performance of our vaccines, and our understanding of how the virus spreads, that moment has come for those who are fully vaccinated. Now, if you are immune compromised, you will most definitely want to talk to your doctor before giving up your mask. Also, locations such as healthcare facilities will continue to follow their specific infection control recommendations. And lastly, this past year has shown us that this virus can be unpredictable. So if things get worse, there is always a chance we may need to make change to these recommendations. But we know that the more people are vaccinated, the less cases we will have and the less chance of a new spike or additional variants emerging. If you develop symptoms, you should put your mask back on and get tested right away. The science is also very clear about unvaccinated people. You remain at risk of mild or severe illness, of death, or of spreading the disease to others. You should still mask and you should get vaccinated right away. This is an exciting and powerful moment. It could only happen because of the work of so many who made sure we had the rapid administration of 3 safe and effective vaccines. It could also only happen because we have an adequate supply of those vaccines for everyone 12 years and older in this country. Your health and how soon you return to normal life before the pandemic are in your very capable hands. If you are not yet vaccinated, please go to vaccines.gov or text your zip code to get vaxxed, that is 438-829, to find a vaccine in your area. Once you are fully vaccinated, 2 weeks after your last dose, you can shed your mask. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. So Dr. Walensky has spoken to you about exciting issues that we can now look forward to when you have vaccination. I'm going to talk to you a little bit about the future of where we want to go with vaccines with regard to coronaviruses, and that is the development of a universal coronavirus vaccine. If I could have the first slide. This is something that has been discussed now for some time. These 2 articles, one in the late press in the New York Times from Carl Zimmer, asking about the possibility of a universal coronavirus, and the other in Science magazine by John Cohen. So what would we mean by universal coronavirus? Next slide. This is the phylogenetic tree of the coronaviruses. The ones in red font are human coronaviruses, and the 4 that have yellow highlighting are the 4 viruses that account for anywhere from 5 to 15% of the common cold.
Dr. Fauci now getting into detail about the effectiveness of vaccines, but the major headline made by CDC Director Dr. Rachel Walensky a moment ago, her words, "We can start doing the things we stopped doing," referencing people who have been fully vaccinated, meaning have gone 2 weeks past the last scheduled vaccination, and basically not have to wear masks in virtually any setting. Let me go to NBC News senior medical correspondent Dr. John Torres. Dr. John, this is a stunning announcement. It was only a few weeks ago we were hearing about wearing masks outside. What's your takeaway of the shift that allowed them to make this announcement?
And Lester, you're right. This is a stunning announcement, and I think it caught a lot of us by off guard to a certain extent because we knew this was coming with the science, but we didn't know it was coming quite so soon. And I think part of this is they're responding to the science. They're responding to other public health experts saying, wait a minute, we know that outdoors, particularly if you're vaccinated, more importantly, then you don't spread the virus. And they brought up a couple of good points, or Dr. Walensky did. She said, number one, we want to make sure that you understand these vaccines are effective, and they're particularly effective against the variants as well. And that's something we're now finding out. Plus, one important point she put in there is we also know now that the transmission rate, if you're fully vaccinated, the risk is very low, and that's an important part to taking the masks off. And so she said essentially that they want to make sure that people understand that because the vaccine rates are high, that's why we're able to take these masks off. At the same time, she did specifically say for certain people, immunocompromised people, people who are unvaccinated, then it could be a different story. Particularly unvaccinated people, they need to keep wearing the masks. And if you get sick and have symptoms, you need to put your mask back on. And also warned us to a certain extent what we're seeing in other parts of the world, that if cases start to go up, then we might need to put masks back on. But this is good news, Lester, because we're finally starting to see sort of essentially the rewards behind our efforts. And that's what one thing that Dr. Slavik or Andy Slavik was saying, that we put a lot of effort into this. It's time to start seeing the rewards from this. And I think that's what we're seeing at this point, Lester.
Yeah, another headline from here. We don't want to ignore this. She also said that unvaccinated people remain at risk of illness, death, and of spreading the disease. So this good news message today going out to those who have been fully vaccinated. And Dr. John, before I let you go, this all sounds really interesting, but in real world, when you're sitting in a restaurant or you're sitting in a crowded space and someone's not wearing a mask, you don't know if they're fully vaccinated. So what are the implications socially now as we go forward and try to incorporate this in our lives?
And Lester, you're correct that we don't know if somebody's vaccinated just by looking at them. So when you're in a situation like that, you might want to err on the side of keeping yourself safe. If you're vaccinated, well, it's a different story. And like you mentioned, unvaccinated, you definitely want to wear the masks. But also remember, these are CDC guidelines. The states and the counties are going to issue their own guidelines. And as of now, they really haven't changed them. So your state or county might have different guidelines. They might still want you to wear masks until they catch up to what the CDC is saying. But again, this is great news because it's showing that, number one, that the transmission transmission rate and the infection rate with people who are fully vaccinated is low. We're getting more people vaccinated so we can start doing more things, Lester.
Dr. John Torres, thank you. Let me turn to Chief White House correspondent Peter Alexander. Peter, I understand we're going to hear from the president about this not too long from now, but we can't forget there was a lot of anger building up. We heard members of Congress really suggesting that maybe the CDC had lost some credibility because it hadn't made this call before.
Yeah, Lester, I think that's right. Obviously, as we witnessed in the last administration where there was a sense that you weren't hearing the science, now there was a sense that perhaps they were being too conservative in delivering, in fact, what the science was at this time. So this day for this White House really provides that rip your mask off moment for Americans right now. And to Dr. Torres' point, for the White House's purposes, it also provides a better communication of the reward that exists for Americans right now. You talk about the president's goal. He wants to hit 70% of American adults that will have at least one shot by July 4th, 160 million Americans fully vaccinated by that date. We're still about 40 million shy of that number, and the number of Americans who've been getting shots has been dropping, roughly 2 million a day right now. That's down about 36% since the peak that we saw in the middle of April. And the hope by doing this is that it does remind Americans that there is a benefit, a real life benefit to their getting vaccinated. The president faced some pressure, including from some of the governors with whom he spoke yesterday. One Republican governor calling on the White House to help better model that behavior to Americans of the benefits, that if you are with vaccinated people and you yourself are vaccinated, you no longer need to wear that mask. They hope that today's announcement will go a long way in getting those who are still vaccine hesitant to come on board as the president tries to hit that mark that he has set as the sort of real Independence Day for Americans as it relates to the pandemic on July 4th. Lester.
All right, Peter, thank you. Stephanie Ruhle is an NBC senior business correspondent. Stephanie, a lot of implications here by what we just heard. I mean, think about it. Right now, I'm sitting in a 70-story building in Midtown Manhattan. I would venture to guess maybe only 20% full. That's the story in business right now. Is this going to force some immediate decisions?
Well, it's definitely a little bit complicated for business. Employers can ask their employees if they've been vaccinated and to show proof. So now that we're seeing this guidance lifted, you most likely will see businesses bring employees back sooner than expected. However, businesses with patrons think customers, it's trickier. How do you really know if your customers have been vaccinated? So for hotels, restaurants, retail, it's harder. And you might see a lot of those businesses still hang on to the mandate because they want to protect their frontline workers, at least in the short term.
Stephanie, thank you very much. President Biden expected to address the new mask guidance in a little over an hour when he speaks in the Rose Garden. We'll be back with you about 3:45 Eastern time or as soon as that begins to hear the president's remarks. But again, the headline from the CDC director speaking to people who are fully vaccinated. You can start doing the things you stopped doing, meaning mask wearing will no longer be necessary. A lot more to cover. We'll see you back with that special report with the president and, of course, on NBC Nightly News with full coverage. For now, I'm Lester Holt in New York. Good day, everyone.